Everybody goes through something, whether illness, injury, loss of loved ones, trying to bounce back from COVID, financial challenges. People need tools to rebuild their lives. We're not helpless and we can't control everything. I used to think there was like a perfect answer, like some guru to find, some pill to pop. And then I realized it's many things together.
We started to see the way violence emerges in any environment, really. We started to think about, well, safety usually to people just means physical safety, but actually we're talking about these four dimensions of safety: physical safety, psychological safety, social safety, and moral safety. And that physical violence actually emerges out of these other contexts, not really just spontaneously of and by itself. So we started to see the complexity of this whole subject, and it meant that we had to learn to listen to our patients. We had to really listen to their stories and try to clear out the obstacles that unintentionally we had often created for them. Everybody understands these issues, what they do, what stress and overwhelming stress does to the body and the mind. And the way we interact in our relationships and in groups. So everybody should know that, like everybody knows that smoking isn't good for you. People didn't know that in the 1950s. So I call that trauma-informed. There are lots of methods out there now, not all of which have an evidence base yet, which are very effective, but non-traditional. In helping people to actually heal and recover and get rid of symptoms. Things that often take into account the creative arts and creative expression.
I think of music as sort of like when you drop a rock in a pond and the ripples go out in circles. The sound waves do that when I play guitar, and there's intention with it too. The intention to offer love and peace and healing and good energy through music. And I think kindness ripples out into the world very similarly.
In addition to the arts, having mentors can be a great source of support. We all need people who can share their wisdom and relate to our journey. I was so lucky to find Dr. Betty Sue Flowers at the University of Texas at Austin.
When it comes to your own life, there are stories that are more productive than others. There's so many stories you can tell about your own life. You can use the same facts of your life and tell your story as a hero story or as a victim story. I often use that as an experiment when I do workshops. Well, I think it's useful in any given encounter where you're the helper and you're supposedly helping someone, or the teacher and supposedly teaching someone, or that's your role, to imagine that if you're the teacher, you're also learning. If you're the helper, you're also being served. So I think a too strict identification with the role can sometimes prevent the gift that you get as a helper. It's a human need to be loved. It's a deeper human need to be loved for who you are. The difference between celebrities and fictional characters is that the celebrities underneath the mask that's being put on them or that they assume for themselves can sometimes be quite different people. So fear is a kind of entry point emotion, and we have to watch where that's coming from because we can be manipulated through our fears.